because we're dealing with an unprecedented topic in an unprecedented time. As you know, we closed schools back in March, about March 13th. There were a group of Merrimack Valley superintendents who made a decision to close schools together. And then the governor and the commissioner of education made a decision to change or to stop school for the remainder of the school year. So we're here tonight to talk with you and listen to you. The purpose of this meeting is to collect information from you. At the present time, I have about a 40-member reopening committee that is working in 4 areas: teaching and learning, operations, logistical issues, social emotional well-being and reorientation in terms of the school year for the 2021 school year, and hygiene protocols that we will be following throughout the year. So we want to hear your suggestions, your opinions, your perspectives, whether you're a parent of a school child, a community member, or a student, because we welcome our students' information and feedback also. Tonight, I want to thank a number of people for participating as panelists. Dr. Carrie Cleary, our Assistant Superintendent of Schools, Courtney Moran, who is our Director of Special Education, a Pupil Coordinator, Ingrid Nielsen, who is our Director of Finance, Jen Burke, who is our HR person, along with school committee members Gloria Miller, who is the chair of the school committee at this point in time, and Vice Chair Alicia Mallon, Secretary of the school committee Valerie Young, Avery Adam, Chris Sanders, Ming Chen Zhen, and Sean Kelly. I want to also welcome Jeff Stevens, the Director of the Health Department, and a particular welcome to Michael Hirschberg and Sana Damani, who are sign language interpreters. Michael and Sana will be sort of shifting off during the meeting, but this is a first, I think, for us, and we're very proud to be able to offer some interpretation for those who are hearing impaired. I'd like to have Gloria Miller, the chairperson of the school committee, say a word to you about the importance to the school committee of this particular forum. Gloria?
Thank you, Bill. I appreciate the opportunity to just welcome everyone here tonight. Obviously, we have a huge number of attendees, and that speaks to the amount of anxiety in the community about this topic. And we are here as school committee members tonight to listen and to hear and be able to absorb the input from the community as we're embarking on this very difficult task. The state has given Westford Public Schools and all public schools across Massachusetts an incredibly difficult task of preparing 3 different plans for potentially reopening our schools and how that will occur. No decisions have been made at this point, but a lot of preparations have been made. School committee and now has liaisons on all of the reopening committees, and we've appreciated being able to gain that insight as to how these plans are being developed and all of the thought and consideration and hard work that has been gone into developing these plans and preparations. So we look forward to the discussion tonight. We look forward to hearing from you. School committee will be turning our video off because we want the focus to be on our administrators and their responses to your questions, and of course the ASL interpretation that we have here tonight as well. So we will be here, but we will be off video, and thank you very much for attending and sharing your views with us tonight.
Thank you, Gloria. With that, I'd like to give you just a very brief background, because I want this to be a listening session for us. And I don't want to dominate this meeting with presentations from myself. Back on June 25th, the Commissioner of Education issued some initial guidance to us for the fall and September opening of the 2021 school year. At that time, there were a number of comprehensive recommendations for health and safety standards, along with the mandate that we prepare 3 models of teaching and learning to present to the school committee with my recommendation for the chosen model. And those models were a full return to school by all students with some distancing, as the commissioner indicated, as little as 3 feet of distancing. A hybrid model, which involves the combination of students being in school on some days and out of school with remote instruction on other days. Half the students being in at a time based on distancing, and we can talk about that as we go along tonight. And a fully remote plan where all students would continue with remote instruction as we did in the last 3 months of the school year. As many of you know, we recently sent out a survey to you, and honestly, I think we could have probably done a little better job in terms of the choices, because at that time, we presented to you a choice of either fully returning to school or fully remote. The reason we did that at that time was to ascertain how many parents felt uncomfortable having their child return to school. Now, that would apply whether it was a full remote or a hybrid, which would have certainly involved students returning to school. And that's why we didn't at that time ask about the hybrid model. That is very much on the table with a full return to school or remote learning. I want to explain also that if a community adopts a full return to school by all students, they are obligated, we are obligated to provide remote instruction to children whose families decide that they do not want to have their child return to school for health reasons. So I'll explain more as we go along. As Gloria indicated, our 4 subcommittees have been working diligently. We're in the process right now in varying stages of writing the report. Some of you have written very nice emails about the fact that you appreciate the work we're putting into it. Some of you have expressed concerns that you think we're behind schedule. I want to assure you that we're not behind schedule. We just received the documentation from the state on the 25th of June. We've been working day in and day out many nights to develop this plan, and now in a very positive manner, including some of the school committee members on our subcommittee. So we're here, as you know, to support you. Okay, I'm entering my 15th year as a superintendent during school year, and we've tried to make it a practice, a culture of being supportive with students, parents, our staff, and the community as a whole. And so we're here to assist you. We're here to provide you with information. Here's the importance of this meeting to us in collecting information from you. This profession is all about connecting. And we cherish the opportunities to be surrounded by our students and by our colleagues and the community. We miss it greatly. We miss it very much. And I know you do, and your students do also, your children do. And so we're looking to have a positive meeting, looking forward to working with you, certainly with the school committee, to develop a plan that represents sound education, but also recognizes the fact that we're still in a pandemic and we have to pay very close attention to health and safety conditions. So with that, I would invite you to send your suggestions, your questions, your opinions. Chris Chu will be monitoring the questions to present to me, and we'll proceed through the remainder of the. Let me just say also that this is being recorded. If we don't get to all questions, certainly, we will develop a frequently asked questions document that incorporates all of the questions and answers to those. So Chris, if you have the questions, because my screen is quite small, if you wouldn't mind reading the question, and then I or Kerry or Courtney or Jen or Jeff can answer.
Sure. So we do have a lot of questions coming in now. So we'll do our best to try to make it through, and then once we get them answered, then that'll also be pushed out to the people watching, so you'll know. But unfortunately, you won't know if somebody else has asked the same question until we get to some of those. So I appreciate your patience as we navigate through here. So our first question actually is if all students return to school full-time without any shifted schedules, what % of the seats will be less than 6 feet apart? Are there plans for installing physical barriers, such as U-shaped sneeze guards on student desks if they're closer than this, as recommended by the CDC? So the question's really talking about what do some of our plans look like at this moment. So if we can discuss some of that.
We've done a capacity survey, just to let you know, of all of our buildings, with the 3 feet distancing. Now that it's the edge of one seat at a desk to the edge of the next seat on the desk, front and back, side to side. That is in accordance with the commissioner's guidance that was sent out on June 25th. With 3 feet of distancing, the only schools that are still remaining tight are the Abbott School, but we can make that work, and the high school. The high school is tight, even tight with even 3 feet of distancing. The 6 foot distancing parameter would require us to go to a hybrid model, because no school in our district can accommodate all students at the same time with a 6 foot distancing factor. Now, here's where I consider this to be one of the crucial variables in this decision-making process. The CDC, and I've consulted with CDC regulations and guidelines, consulted with our local health department director, Jeff Stevens, and town nurse Gail Johnson. Close contact, as defined by the CDC, is anything that is within 6 feet for a period of 15 minutes or longer. Now, that is one of the very important variables that we are looking at with our reopening team. Can we bring all students back with safe conditions, or do we think there needs to be some alteration of the commissioner's recommendation of 3 foot distancing between chairs? So we're looking very carefully at that, because that is a crucial issue. Chris, was there another part to that question, please?
No, that's, I mean, basically questioning how we're handling the guidelines, and whether we're going to be looking to install barriers and things such as that.
The only desks that we would be installing barriers at would be trapezoidal tables if the students are facing towards each other to some degree, or circular tables. We would in fact look to replace the circular tables with rectangular tables. The guidance document from the DESE says that all students are to be facing in the same direction, so as to minimize any moisture that might be coming from a child. What the distancing requirements would mean also, whether it's 3 feet or 6 feet, is that we would have to be removing some sort of small group instructional tables from elementary classrooms. In all likelihood, there would not be a rug where there would be reading circles or social circles or community meetings and gatherings in the morning. Those would have to take place in alternative spaces, perhaps such as art or music rooms or some other auxiliary instruction space. That would mean, in fact, that art and music would have to be in certain schools on a cart, but we'd still make it work. So as we transition through these questions with the answers, whether it be from myself or Carrie or Courtney or Jen or Jeff Stevens from the health department, I think you'll begin to see how many complex parts of the puzzle we are trying to solve, because everything is interdependent. If we change something, it affects something else in a building. And so that's one of the challenges, but we're meeting that challenge. All right, another question, please. Chris?
So we have a bunch of questions where people are asking about the differences in remote learning plans and different things like that. So I'm gonna basically just, the first question is, how will distance learning be different in one of these models? So perhaps maybe Carrie could start with that question.
Sure.
Good evening. Hello. That is a terrific question. And as you know, we had some great practice from March through the end of the year on getting acquainted with online interaction with students and assignments. However, what we did not have is the preparation time to make sure that certain teachers could be on at certain times and those 20 or so students in their classes would be available during that same time. We couldn't ensure that. We were operating in crisis mode, and with our staff having their own families at home and family members figuring out what to do with their children who were suddenly home and unexpectedly, we did not feel that our community was ready, although some were, to have really prescribed times to be online with the teacher. With our remote learning model plan moving forward, and right now I'm speaking to the full remote learning model, which the superintendent talked about the 3 plans. There's the full return, the hybrid, and the full remote. So if we went fully remote, we would certainly have times where there's live instruction, log on at a specified time with your class and with your teacher, and there would be some live work being done and then asynchronous work as well. We have not yet identified what remote learning would look like if we come back for a full return or for the hybrid model for those families who wish not to send their students back to school. The reason for that is that we have to first understand and identify what we're doing in terms of a full return or a hybrid model. Once we determine what that plan is, then we can understand and assess what staff we have and how we would organize a remote option for the families and the students who will not be returning to school. So that information is to be determined. However, all of that said, we are definitely planning something that does have, or our objective will be that that plan does have synchronous learning, live teaching opportunities, and will not copy what we did from March through June, because those were very different circumstances. There were questions that had come our way. In the case that they come up tonight, hopefully preemptively we can address some in our comments, but we have been asked whether or not students would need a doctor's note to not return to school, a doctor's note indicating that they have some sort of medical condition that would put them at higher risk coming to school. And that answer is no. Parents have the right to hold their students out of school and choose the remote option if they are not feeling comfortable sending their children to school, whether it's a medical issue or other.
So along that same lines, there's also a question about switching between the models. And so, Carrie, you even just mentioning how, you know, different people could be making decisions based on their needs. So can we talk about, first of all, can people switch what's happening if they find that they are not able to return and they are doing fully remote because of medical concerns? Is that something that would be able to change? But also the question here is, how easy is it going to be for us to switch between models based on different information that we're getting throughout the pandemic?
Our group, the superintendent has me facilitating the teaching and learning group, and our group did speak about that. And what we would look to do is have some sort of benchmark, maybe the first quarter, to then reassess and say, okay, is there anybody who would like to switch from fully remote to whatever our model is, whether it be hybrid or in school. However, parents absolutely can do that anytime. So if a parent starts out fully remote and then decides they want their child to go to school with their peers, and maybe we're only 2 weeks into school, they certainly have the flexibility to do that. We'll just be shooting for certain benchmarks along the way for organizational purposes on our end, but by no means are parents bound to that.
Great. So we also have, there've been a couple of questions about the participants on the subcommittees. So Superintendent Olson, can you talk just a little bit more about, again, the different 3 subcommittees and the professionals that are on there?
Yes, we actually have 4 subcommittees. The teaching and learning, which is being facilitated by Kerry. The operations and logistical issues, which is being facilitated by myself, and I'll get to the membership in a second. The social emotional adjustment subcommittee, and also the hygiene protocols and facilities cleaning subcommittee. What we've tried to do through soliciting interest through our staff was develop a good cross-section on each subcommittee of sometimes preschool, elementary, middle school, high school, staff guidance counselors, adjustment counselors, school psychologists, administrators, school nurses. So in fact, what I'm going to be doing is tomorrow morning, we will be publishing with the list of the subcommittees that we have already posted on our website. It has the names of people, but we're going to add their titles so that people know what position they're in, and that is a good cross-section of staff representing the entire school system and not weighted towards any particular grade level. Another question, Chris?
Yes, there's been some questions about the metrics that we're going to be using to make different decisions in terms of which of the models that we're looking to use, and based on then what changes that might have to make in the fall. So I don't know if that's something that that Jeff can also chime in on.
Yeah, I will. I'll start, if you don't mind, Jeff, just stating what we are looking at. First of all, I look at the dashboard information from the Department of Public Health in the state of Massachusetts. Gives a terrific analysis of the number of active cases. Jeff, if I recall correctly, in my most recent conversation with you, we have 3 active cases in Westford of COVID-19, the COVID-19 virus. I consult the CDC guidance documents, consult with our school nurses, as I said, with Jeff Stevens and Gail Johnson, our town nurse. I take a look at the DESC data that has come out and will come out that combines data from epidemiologists, Massachusetts General Hospital, and some research information, not only nationally but internationally, from the American Academy of Pediatrics. Now, that being said, data is data, but I want to make sure we thoroughly talk it out and determine what's best for our students here in Westford. But we're not flying blind here. We are using the most up-to-date data, the trends that particularly pertain to Massachusetts and Westford in particular, to assess the degree of safety of either full or partial return or full remote. And I will say our school nurses and our health department have been absolutely terrific. Jeff, I don't know if you want to speak to that at all.
Bill, we're happy to work with the school department. We're happy to be there every step of the way. And all the information you gave is accurate, with the exception of, unfortunately, Westford has picked up 2 other cases. So since our last conversation, we now have 5, which people on the website. And just to give a quick overview on that, the number of cases you see actively changes on a regular basis. It's not always the same person. or the same case. So that number does fluctuate from time to time. And as we get information, we are working to break down what we do have in Westford. We've had 150 total cases in the town, and we can break that down by age group if need be, and we can share that with the school department and make sure that everybody has the most up-to-date information on the town.
Thanks, Jeff. Chris, I just want to mention to the parents, this is accessible data also to all of them. I'm just going to thumb through it quickly. This is the data that we refer to from the Department of Public Health in Massachusetts in terms of the dashboard presentation of public health indicators. What we have been doing in terms of our planning in the operations and logistics subcommittee is we have a spreadsheet that we have developed, a comprehensive spreadsheet that indicates for a variety of tasks that we go through during the school day, between school bus transportation, early arrival, transitioning to classrooms, lunches, bathroom breaks, recess, what integrated arts will look like, about 20 different topics: school safety under COVID-19, and also any particular accommodations that are needed in all of these categories for our children with disabilities. We have also, the principals have been designating, and I know it's hard to see, and we'll put it up on our website, specific doors around the schools where students will be entering and exiting, entering during arrival in the morning and exiting during dismissal in the afternoon. So all in an effort to try and maintain as much distancing as possible. I do want to indicate, and I know this question may very well come up tonight also, we have been very active in ordering personal protection devices, masks for adults, masks for children, although the guidance does say families are responsible for masks and the staff, gloves, gowns for our nurses and some of our special education staff, full plastic face shields for our staff, eye protection, because the medical profession has said that a lot of the transmission of the virus in that particular profession is through the eyes. So we have goggles also, along with the face shields, hand sanitizers. We will have hand sanitizing stations throughout the school. And so we want our staff to know, we want our parents and our students to know that we have been preparing with the personal protection equipment to keep them as safe as possible should there be a partial or a full return to school. And I'll stop talking for the next question.
The next question is actually, in a full return hybrid model, what happens when a student or a teacher is diagnosed with COVID-19? So that would actually be a good thing for Jeff to chime in on with us, as he's been talking with us about that as well.
Sure.
Yeah.
Go ahead.
No, Jeff, can I just say, because this is one of the components we've put in our report, and I just want the parents and the staff to know that we understand what to do. And Jeff, please correct me if I'm incorrect on anything and chime in. If a child or a staff member tests positive, those test results are sent to the Massachusetts Department of Education. They're incorporated into what's called the MAVEN database, the Massachusetts Virtual Epidemiological Network. The local health department in the respective city or town is contacted. And Jeff or Gail, correct me if I'm wrong, Jeff will do an investigation in terms of the symptoms, who was in close contact with that individual. Was it closer than 6 feet for over 15 minutes? Okay, because it doesn't necessarily mean if a person tests positive, if they have been more remote from other students or staff, it does not necessarily mean that there has been a serious risk to other students around that person. The individual who tests positive will be out for 10 days, right? Because it takes, well, if they test positive, they'll be out for 10 days. If there are others that have been within close proximity to that student or that staff member, they will be out for a 14-day period, because in some instances, it can take between 2 and 14 days for the virus to express itself in an individual. I'll stop there. Jeff, please, if you could, I wanted to just let people know that we've tried to do our homework to understand this so the staff and students and our parents understand that we know what to do. So Jeff?
Sure. So what has been happening in town so far, and really every other town in the Commonwealth, is anytime a person is identified as positive, the health departments are doing contact tracing all the way through the last people that person has been in contact with, and then those people are notified. That process will absolutely take place if there's a positive case within the school community. And right now, what the state is doing is working on a more defined set of guidelines for contact tracing within schools, because we know that there will be people slightly closer than they would be said if you're at the out and about. And what's important to realize is what being a close contact really is. It's within 6 feet for greater than 15 minutes. And that also applies whether you have a mask on or not, or a face covering. So that face covering is, as Gail puts it, is simply a barrier and does not prevent you necessarily from being a close contact. It may be protecting you from getting sick, but not necessarily from being the contact. So what will happen if we have that case is we will be doing contact tracing according to what the DESE guidelines are going to be. And Bill, I believe we're still waiting for those to be released on what those are going to be set up as. DPH is working really closely right now with the Department of Education. And I'd like to hope in the next few weeks we'll actually see that guidance on how we'll be able to handle that positive case within a school community.
Thanks, Jeff. Chris, aligned to that particular question is the issue of school bus transportation. One of the frustrating aspects of the trickling of information is we still do not have the guidance on regular transportation and special education transportation. That is expected to come out sometime within the next week. I understand that the state officials are absolutely doing the best job they possibly can, and I will not criticize them. But I was on a meeting with area superintendents today, about 25 other superintendents, and we're extremely frustrated that we don't have the full guidance, particularly now with school bus transportation, to develop that component of our plan. Chris, the next question, please.
Sure. So the next question is, how will children in special education who need movement breaks be accommodated? And I think that also just includes a number of different types of breaks and different types of accommodations that we'll be making for special education. Courtney, are you available to help with that question?
Sure. So I think in your question, you mentioned it. We don't know exactly what all the accommodations will be necessary as a result of students coming back wearing masks and re-entering school for the first time since March. We are very aware that this school closure that occurred in March may or may not have added to a little bit of trauma that someone might be feeling, a little bit of regression possibly, as well as the real possibility that there might be other students who may be diagnosed with a disability such as anxiety when they do return to school. So each of our subcommittees that Bill and Kerry had mentioned, we have special education representation on each one of those planning teams. And our hope and our goal is to make sure that we are working through each one of those possibilities so that we can welcome all students back in our school to the maximum extent possible. Clearly, if there are students that need, whether they're special education or general education, any kind of a movement break, kind of a mask break, we are going to be learning from ourselves when we find out what our own tolerance is for wearing a mask for 6 hours a day possibly, as well as taking our cues from students. And we are certainly committed to refining what our thoughts and guidelines in practices will be so that we are making students feel comfortable, feel safe, feel connected with their peers and their teachers who have missed them so much, and ultimately being able to educate them.
Chris, I'd just like to mention also that I'd like to ask the parents to practice with the children on a graduated scale, wearing a mask a little bit more and more during the day, starting now, not waiting. Some students have sensory issues that make it particularly uncomfortable. With all of us, as Courtney said, find it difficult to have masks on for extended periods of time. And reading the literature, particularly as it applies to children with disabilities, one of the strategies that parents can adopt during the summer is to start off with maybe 5 or 10 minutes, 20 minutes, 30 minutes, and then keep working up, perhaps with some positive reinforcement, because this is going to be difficult. There is no easy way for anyone to wear a mask for 4, 5, or 6 hours during a school day, whether you're a child or whether you're adult. So look, we all know that we can't wait to get out of Market Basket or a retail store and take our mask off in the car, and that's what we're all experiencing. That's reality. So I would ask that you perhaps start the practice with your child with some positive reinforcement for longer and longer periods of wearing the mask.
Thank you. So the next question is about the surveys. And so a number of people are asking if the results are going to be shared and or what those results are. People have been asking questions about the number of people who requested fully opening the schools and whatnot.
Yes, those results will be presented to our school committee first, even before we have our next school committee meeting on the 27th. Out of courtesy, we always want to present them with the information, but then we'll put it on our website. We've had excellent response from parents on the questions that we've had. That is one of the data points, okay? But I'm combining that, and our committee is combining that with all of the other sources of data that we're gathering, including tonight's feedback from our community and tomorrow's feedback at 1 o'clock. I have a meeting, a forum like this with our staff in the school system from 1 to 3 tomorrow, and hoping for some feedback, particularly from our staff, on what their concerns and hopes might be.
Thank you. There have been a number of questions, again, still about the remote learning plans. And this question is asking if students will be receiving grades, or will it be a continued credit, no credit like was in the spring?
Carrie, you want to take that one?
Sure. Yeah, the credit, no credit that took place in the spring was basically guidance from the commissioner, a suggestion from the commissioner that we all very much agreed with because of the given situation. We had parents who were suddenly losing their jobs. We had students who were in home situations that weren't conducive to learning at all. And again, no preparation time. So we did not feel as though it was appropriate to penalize students who couldn't necessarily participate as well as they would have had things carried on normally throughout the spring. So in our plans that we're creating for remote, hybrid, and in-person, we do intend to have a more formal grading system, assessments, accountability for students. So it will feel more like school in that sense, although of course how we do that will be different, will feel different regardless of which model we go with, but grades will take place.
Terry, can you also talk about, we have some questions about Chromebooks, and so some people have been asking if Chromebooks will be provided if we go with remote learning, but can you just talk about the shift with Chromebooks that we're looking at, which would support both remote learning and a full return?
Sure. One of the things that we were planning, as the superintendent mentioned in the June 25th guidance from the commissioner, was to move forward planning with a full return, doing the feasibility studies and keeping the hybrid more for situations where you can't accommodate everybody at 3 feet. So even at that time, when we were thinking students will likely all come back, we didn't want students sharing devices. And of course, this is a moot point at WA because we have One2World there where every student is assigned their own Chromebook. So as we began reshuffling Chromebooks throughout the district, just on a spreadsheet, we determined that we are able to have 1 Chromebook per child for in school. And of course, that could translate to remote as well. The middle school, we do intend to go more one-to-one, similar to the high school. And at the elementary level, where carrying devices like that back and forth to school would be a little bit more potentially problematic, we were talking about having 1 cart per classroom for where each student would have their own assigned Chromebook that in the morning they'd come in and take Chromebook number 12, for example, off the cart. Each day that child would be assigned to Chromebook number 12 so that there wouldn't be sharing. So all of that said, we are able to accommodate everybody having their own device, and how we would deploy those, we would have to revisit if we're going full remote. There are lots of families who have indicated that they're all set, they have technology at home, but we are equipped to ensuring that everybody has access to any sort of virtual learning that might take place.
Great, thank you. As you can imagine, there are a lot of questions about logistics, and one specifically that is coming up quite a bit is talking about hand washing and sanitation in general. So there's one question that is asking how we plan to implement a hand washing program at the elementary level. Can somebody take that question?
Well, what we're doing, that's one of the topics of discussion on our operations and logistics subcommittee. We will have hand sanitizing stations in every classroom. Not all classrooms have sinks and with access to water in them. So there will be breaks from time to time for children to wash their hands. It will more likely be hand sanitization. We are going to ask parents if they would at least begin to start the year sending in a container of sanitizing gel with the students. We will have gel sanitizing material in the classrooms and also the stations with the foam dispensing. The reason I'm going to ask parents to send in hand sanitizer, Chris, is that the guidance from the commissioner is that before a child removes their mask, or an adult also, they have to sanitize their hands. And before that mask is put back on, they have to sanitize their hands also. So that's one of those things that we're going to be working with our teaching staff also, because the amount of work that we're expecting from our staff, similar to the amount of work that we really threw them into in March, April, May, and part of June this past year, is extraordinary. And we want to do everything we can to try and cut down the amount of attention that a staff member has to devote to routine logistical and hygiene issues from instructional issues. So that we're talking about that issue. We've been talking about it this week in our subcommittee in terms of what does that look like. I mean, we've figured out everything else in terms of transitioning through hallways, and what do we do with lunch, recess, and how does that work? But the sanitization and the hand washing throughout the day is a complicated item, because we can't have children up every half hour washing their hands. So the hand sanitizing material is very important to us.
Thank you. The next question is whether full day kindergarten is still going to happen.
Carrie, I think your committee has been talking about that.
Yes, so we are waiting to see what plan we are going to move forward with in the fall. And once the superintendent has recommended to the school committee and the school committee has approved what plan we're going to be moving forward with, at that point, we will determine if there's a significant difference between full day and half day kindergarten. So that is still to be determined.
Chris, may I make just one comment before we take the next question? This decision that I will present to the school committee may possibly be different than a decision that other superintendents in other communities will be making for their respective school systems. Doesn't mean that we're right and they're wrong, or vice versa. It's just we're trying to work with the data in the individual communities, because it can vary greatly between communities. And this is where I'm going to have to ask for as much patience and understanding as possible. We all want to have children come back to school. We all want them to come back full time, because the disruption in their lives, disruption in work, disruption in family lives has been extraordinary, just extraordinary. But we need to do the right thing. So if I bring forth a particular model to the school committee, it could potentially be different than Chelmsford or Tingsboro or Billerica or Concord Carlisle or other communities. And I need people to be willing to accept and understand that. It's based on our data, our school system, our community.
Thank you. So there was a question about whether the question is, how do you plan to respond to the stance of a phased approach as recommended by the Massachusetts Teachers Union?
Well, the MTA and the AFT, the American Federation of Teachers, and another union have come out with, I think I read it a couple of days ago, 4 or 5 phase program. The first phase being a 6-week sort of reorientation period. It is, it's very thoughtful, but I don't see us as the superintendent of schools. I don't see the necessity of delaying the school year for 6 weeks to 8 weeks. I think we can build in. We have 3 days built in at the beginning of the year. Now, the Commissioner of Education may relax the 180-day requirement for students by taking some of those away from instructional days and devoting them in school systems for professional development. The Commissioner may also waive the 900-hour requirement for elementary schools on time and learning requirement, and it's 990 hours for both the middle school level and the high school level. With all of the attention to hygiene issues and sanitization, hygiene practices, I don't see, nor does any other superintendent see, any way that any school system can meet those time on learning requirements. And so I believe those are going to be relaxed. But I think the union's proposals were very thoughtful, but they make it a little bit difficult to get that momentum going at the beginning of the year. And I think we can adequately plan for that without a 6-week period, or sort of incubation period.
Thank you. I did want to just take a second to let everybody know that we are doing our best to try to get to the questions. We have approximately 10 to 15 questions being asked per minute. So it's not going to be possible for us to get to all of them. So we're trying to go through and get different questions that thematically are similar to others, so we can address as many different things as we can. So I appreciate everybody's patience.
And please let me remind parents and staff that we will answer the questions through a frequently asked questions document. We absolutely know that with 600 to 800 to 900 people on this forum, there is no way that we could ever answer all the questions. But we want to make sure that we answer essentially the nature of each issue that's being brought up in a frequently asked questions document.
Great, thank you. The next question, there's been a number of questions about before care and after school programs. So can we address the early arrival, before care, and after school programs?
Yes, at this time, our subcommittee, the Operations and Logistics Subcommittee, is taking position that we are going to suspend for a while the early arrival option. Now that's an option that I started about 15 to 16 years ago when we had bus fees, and I wanted to make sure that the pace of arrival of vehicles, whether school buses or parent vehicles, was somewhat metered. It has become more of a convenience for parents to be able to, and understandably so, get to work on time, particularly in the areas closer to Boston. But here's the problem that we're looking at right now. There are a number of rooms that would be used for that early arrival option. We would not have the time to sanitize those surfaces once the early arrival program ends in the morning and school begins that morning. And that's a concern to us. We want to have as few people in the building, no visitors, okay? Things by appointment only, dropping off things to parents and visitors outside the building. We also want to minimize the amount of touching of surfaces by people, and that's one of the decisions we have come to in the early arrival option. We're still looking at right now, this week, the after-school programs. I think our initial position, is that we would have no after-school programs for that same reason. However, I'm going to have a conversation with Recreation Department Director Jim Duane about that to see if there's some alternative to that. But the goal, once again, is to minimize the number of people in the building, the number of touches on surfaces by people.
Thank you. There's been a number of questions about the 3-foot spacing, specifically in response to 6-foot spacing, and also about accommodations that would be making in the building. So one question specifically said, can you speak to the accommodations that are anticipated for Abbott and at Westford Academy in the light of the fact that even the 3-foot spacing would be tight in those buildings? So there's been people who've been wondering where we're coming up with the 3-foot versus the 6-foot. So if we can talk about that.
Yes, the original guidance many weeks ago was 6 feet of distancing. Now, that distancing is, if you look at a desk with a chair behind it, it is from the edge of the chair of one desk to the adjacent edge of the chair in the next desk, to the left or right, and certainly from front to back also. So that 6-foot parameter was initially advanced by the governor and the commissioner. It's based on CDC guidelines in terms of what represents close contact, keeping in mind close contact was anything under 6 feet for 15 minutes or more. And then based upon the epidemiological research worldwide and in this country, I want to mention once again and stress that the commissioner and the governor have been basing decisions on data from other nations also who have experienced this virus in perhaps a different time frame than the United States. Then they decided that based on the research that has shown that children in ages between the ages of 3 to 18 or 19, some have stretched out to 20, are far less likely to contract the virus than many adults, and far less likely to contract it and transmit it. And so there's where they made a decision based on consultation with pediatric specialists from MGH to move that down to 3 feet, because I think obviously that they knew that 6 feet of spacing was going to be very, very difficult. Now, given the 3 feet of spacing in the Abbott, and which is right next door to us here in Westford Academy, we will have to be using alternative spaces. We will use the room upstairs that used to be the library, perhaps for some classroom activities, perhaps the stage for art or something, some other auxiliary instructional or integrated arts instruction. What Mrs. McDermott is doing also is she's looking at the size of each classroom in the Abbott and altering the number of students such that some staff might have fewer students and some staff might have more students. Now, still falling within the school committee guideline of 22 to 1. So it's a challenge, and that analysis has been done. And I want the teachers who might be viewing tonight, and I will explain to them again tomorrow, that analysis has in fact been done. But as you know, the Abbott has some of the smallest rooms because it was built back in the 1950s. It has the smallest rooms of any of our schools in the entire school system. We wouldn't rule out the possibility of using some of the former preschool rooms in the Millennium for specialized activities. So there are a number of alternatives that we're still looking at, but that is sort of the nexus of the transition from 6 feet of spacing down to 3 feet of spacing.
A couple of questions have shown up where people are actually asking about if family members test positive. We talked about what would happen if students or if teachers tested positive, what we would do during the day. But the question has come up, and again, and if you mentioned it earlier, I apologize. But if you or Jeff could talk about what information and what do we do if we learn that parents test positive.
Jeff?
Sure. So really, this question has been, this situation's been occurring throughout Westford and the Commonwealth nearly every day since the reopening. And what's happening is, if you have family members that are tested positive, the immediate family becomes close contacts and they may be quarantined. So in every situation, contact tracing and the epidemiologists are going to determine who is going to be quarantined at any given time. So you may have a teacher who may become infected at some point. They may need to quarantine. They may, if they have kids in the system, they may need to quarantine as well. That process actually won't change for anybody that's already occurring currently. I can even refer to a case that's happening right now in another town where I was asked to consult on. There's an entire restaurant that's closing because one worker tested positive and 23 of the 31 staff were determined to be close contacts. Therefore, that restaurant needed to close. I'm not suggesting that that may happen here. It certainly is a possibility that one person can come in contact with the virus, and that contact tracing will determine how many people are going to have to quarantine. There are going to be times where there'll be monkey wrenches on how that's going to go for sure. And I think we'll have to take it on a case-by-case basis, and we'll have to do the best we can with the information in front of us. But one thing that I'd just like to point out is there's no such thing as a contact to a contact. You have to be identified as such, and just because you may think you were around somebody, you may not be a person that is a contact. So that's what we will let the epidemiologist and the contact tracers identify as cases roll through.
Thank you. Again, there are a number of questions about logistics and about things that what we're going to be doing in the buildings, about hallways, about bathrooms. One of the questions that came up as well, though, is about using outdoor areas for learning, tents, or taking classes outside. Bill, can you talk about that?
Yes, that's a possibility. In fact, tomorrow I'm going to, when I have my forum with the teaching staff, I'm going to ask if any of them by school are interested in meeting with me in a large outside area adjacent to their building with us all appropriately distanced. I'll be very willing to meet with them face to face and keep that personal connection going. But it is possible, certainly subject to weather conditions, and at any time. For many years, the many years I've been here, there have been teachers taking their classes outside. I would not make a practice of that, only because We do know that there will be some inclement weather, and so those should be, I think, on special occasions, but it is permissible. It doesn't make any difference whether instruction takes place, as long as all the tools, the equipment, and provisioning necessary for a lesson are available to students. Doesn't make any difference whether it's inside or outside.
Thank you. There's also a number of questions that people are asking about the expectations that we'll have for students in the building, and one person specifically articulated by asking, what will the disciplinary actions be if students aren't following the rules in place, for example, not wearing masks or not following the social distancing rules?
That's one of the issues that we're discussing with the Social Emotional Adjustment Committee. There's where we don't want to make examples of children, but this is where we're going to make contact with the parents to make sure that they understand how important it is for children to wear a mask. Now, if it's a problem with for example, a sensory issue with a child not being able to wear a mask for really any period of time, we may suggest to the parent that that child be educated remotely until this pandemic is over, or a reliable research-based vaccine is available throughout the nation. So that's something that we know is going to be a reality that we're going to have to deal with. But we'll deal with it as with as much caring as possible. You know, we're required also. We talk about this issue when you talk about children and staff who present symptoms. Let's take a child in a classroom. The state has said we need to have an isolation room. Well, it's not going to be an isolation room. It will be a caring room that will be set up for a child to wait in before until the parent comes and is able to pick them up. So we're trying to be as sensitive as possible to children and families, to their feelings, to their needs, because of the extraordinary anxiety level that we're all going through. Believe me, to our parents, don't think for a second that we have ever underestimated the anxiety that you are experiencing. It is the same anxiety, as I've said before, that we're experiencing, with incomplete information, being asked to come up with comprehensive plans and keep children and staff as safe as possible. But we're doing it. We are going to do it. So next question, Chris.
Yes, there's been a couple of questions about the timeline here again. This question specifically is, when can we expect the final answer for the plans?
Well, my plan will be sent to the school committee on July 24th. That's a Friday afternoon. It will be discussed in a school committee meeting on July 27th. Now, here's the frustrating thing to all of us as superintendents. The governor and the commissioner is taking his direction from the governor, both fine individuals, not complaining. But it's unrealistic to expect us to not release our plans until sometime in August. Look, the anxiety level is through the roof right now, and it's mid-July. You add a month onto this, and that's not fair to parents, and it's not fair to children. It's not fair to our staff. And so I am going to be making my recommendation to the school committee on the meeting of July 27th.
Great, thank you. There's been questions, again, some more questions about special education and services. And so if Courtney could help us out here as well. This one question specifically is talking about small group classes and what accommodations and or what expectations will be put in place.
So I think that will depend on what model we're looking at. Clearly, if we are fully back in school, following the safety guidelines, parents can anticipate that we are following that IEP to a T, that students are going to their small group settings. The same provisioning that we are looking at in terms of spacing will also be provided within those groups. Sometimes when we say a small group, we're not necessarily talking about a small space. Some of the classrooms are about half the size of a normal classroom, but other classes in buildings have the luxury of having a full-size classroom. So the physical distancing in those small group settings will not be as impacted. Now, if we go into a hybrid model or a remote model, we are still going to try our best to bring students in for in-service, for in-person services, regardless of whether that's the hybrid or the remote. The only thing that would stop us from doing that is if we have a state directive from the governor, like we did in March, that completely shut us down. And so what that might look like for some of those students would be coming in at an appointment for a specific therapy, whether it's ABA therapy, speech and language, OT, or PT. There are some other small group instructions, such as English language arts and math, specialized reading instruction, which can continue to be provided via teletherapy, which could happen. So there are many different ways that we will improve what we did in the spring to make sure that our students are getting the services that they require. But again, maximizing the in-person services, especially for the students who we know cannot access remote education because of their disability. Who that might include would be our youngest learners, our 3, 4, and 5-year-olds that are coming right out of early intervention. It might also include some of our students who have significant communication and or behavior or sensory issues, some that might require using augmentative communication devices from the beginning. And so those are the students who we would definitely want to make sure that we are optimizing their in-person services to the best of our ability.
Thank you. More logistics questions. This question is, how will lunches work? Will students be eating in their classrooms?
Well, the commissioner in his guidance has recommended that students eat in their classrooms. I'm not sure if that's the best practice. What we're looking at now is if, for example, if we have a full return of students with 3 feet of distancing, I would prefer, and we're talking about this with our food service director, I prefer to have multiple lunches and allow students to get out of the classroom, be appropriately distanced in a cafeteria, removing their masks, but maintaining at least 6 feet of distance. In a classroom, also particularly with the younger children, sometimes there's a tendency of somebody to say, I've got my peanut butter crackers here, or I've got my cheese-filled crackers. Can I trade that for your package of Twinkies? And that happens. We're not looking for that to happen, and because we're not looking for even children to share materials, crayons, pencils, paper, etc. So we're looking at if we go to a hybrid model with only half the students, we're looking at the possibility certainly of feeding our students in the cafeteria. Could be bag lunches, but I will say this. The Teaching and Learning Committee is looking at some interesting alternatives when it comes to the hybrid model. And so that may impact the school lunch program. So, that is being discussed. I had a conversation with Kerry earlier in the week about an interesting model that has come up in the Teaching and Learning Committee. And so that could have an impact on school lunches also, whether or not we serve lunches in the school. So stay tuned. It's, I don't want people to say, well, gee, there seem to be a lot of things that still haven't been determined. In some respects, that's true, but we're getting there. This is an iterative process. Once again, everything is kind of interdependent. If we change this changes over here. It's like the economy. Every action has some reaction, and that's what we're dealing with here in our planning.
The next question is, plans for school activities and sports. There are a number of people who are asking about athletics and about all of the various extracurricular activities that we would typically be offering.
Well, we're going to encourage that any co-curricular activities be held virtually. Okay, we want the custodians at the end of any day, whether it's full return or hybrid, to be able to clean surfaces as thoroughly as possible. With respect to athletics, some may be able to run. For example, golf, which does not necessarily involve close contact, does not necessarily involve the projection of moisture from either the mouth or the body, different than, for example, basketball or football, where that contact does create, some dispersal of moisture. That's something that Jeff Bunyan, our athletic director, is looking at with middle school and high school coaches to see what might be possible to run safely and what might not. As you know, some of the colleges around the country right now are suspending fall sports and sometimes winter sports for the next year. And so we're going to look at it carefully to see if something can run, but it has to run safely. We have to be assured of that.
Thank you. Courtney, there's been some additional special education questions as well. And so there have been some questions about even students who require one-to-one support and how that is handled with all of the physical distancing.
Sure. So I think that, again, depends on which model we're going to be going with, what the interaction may or may not look like. Some students do require one-to-one support, but not necessarily over the shoulder or hands-on. So it depends on what can be completed following appropriate physical distancing. In cases, and there will be cases, that we have students that do require more hands-on, we will be taking extra measures as far as PPE. Bill had mentioned earlier that we are in the process of securing all those PPEs, and some of them do include gowns. It's kind of like those surgical yellow paper rip-off gowns that you would see in the hospital setting. We've considered having our staff wear scrubs. We will have masks, and some of our therapists who are in close proximity might also have to wear a shield in addition to the mask. So we are looking at different things. We're following guidelines. There is a tremendous amount of training that is being put out through the CDC and through other organizations of staff members who have to come in close contact. So any kind of service provider in the medical field, we would be expected to follow some of those same guidelines when we are in such close proximity. And some of those cases might include occupational therapy, where there is hand over hand, physical therapy, where our physical therapist might be helping to manipulate the child and or stretch the student. And then there are some behavioral issues where that hand over hand is very important. So we are continuing to look at what those look like. I will be communicating soon with our population of teachers who really target that population of learners that require more hands-on or close proximity, making sure that we're providing the appropriate training and that they will be ready to go in the fall.
Chris, may I just say, prior to the next question, which is an excellent question about alternative spaces around town, I just want to say that the guidance document for parents is that we do not do temperature checks. We were in the process of procuring some very sophisticated thermal scanning equipment that would allow a large volume of students, appropriately spaced, of course, to enter a building over a relatively short period of time and do temperature checks. That is no longer on the table with the Commissioner of Education and the Department of Public Health. What they have told us is parents need to monitor their children and self-check. And we're going to put in our report the list that we have of COVID-19 symptoms, many of which are similar to the normal flu, the common flu. Except two of the distinguishing factors, more distinguishing factors between COVID-19 and the common flu is loss of taste and loss of smell. So that's kind of a telltale indicator for health department officials. Now, I see on your on the screen, the next question is, could we use other spaces that have large common places in libraries, hotels, etc.? My answer is that we want to be very cautious with doing that. Schools are built with particular life safety codes. And in many instances, some of those other spaces, other buildings, whether it's a hotel or some other even town facility, may possibly not possess life safety equipment, alarms, sprinkler systems, etc. The other aspect to that is that in our schools, we can control the number of people in them, children and adults. We can't control that in hotels or the Roden Bush or the Westford Library or other, where there are patrons once open that will be in and out of there. So that enhances the amount of contact with other humans. And so we'd rather keep it as contained as possible within the Westford Public Schools. Great question, but you know, I want to explain a number of complicating issues that we deal with something like that.
Great. The next question is, will wellness, music, art classes be held in the fall? Carrie, can you talk about the different integrated arts and the classes for the different models?
Yes, we certainly value all the programs that we have, and we are looking to come up with models that do maintain those programs, but obviously do so safely. And some of those other content areas, such as PE and in some cases music, certainly there is a heavier risk factor. However, we're working with the curriculum coordinators who are communicating with their teachers on ways to modify that so that the students are still experiencing those courses and getting the sort of rich instruction in a way that isn't necessarily playing basketball and PE. We're looking at ways that people are not sharing equipment. We're certainly looking closely at the use of instruments and chorus for obvious reasons, using the mouth. So we will continue to evaluate that, but at this time, unlike some of the other communities, we are not having a model in place at this current moment that altogether eliminates those classes.
Thank you. The next question is talking about the organization of students at the middle school and at Westford Academy. Specifically, it says in schools such as the middle schools and Westford Academy, where the students change classrooms for every subject, each student may be in class throughout the day with 100 different students in a given day. What will be done to minimize the number of different contacts for those schools? Are you considering smaller sized student pods or models where teachers change classrooms rather than students? I can quickly address what Mr. Hislop and I have been talking about with the rest of the middle school leadership team. For the middle schools, we are actually looking at reorganizing so that the students stay in a smaller advisory group throughout the entire day, with the possibility of having the teachers move as well. So we are looking at those scenarios with the different models. And I know there's been conversations about how they're going to, what they're looking at Westford Academy. If someone else can talk to that while I look for more questions.
Bill, would you like me to chime in?
Yes, if you would, please, because I think your group has been discussing that a little bit about Westford Academy.
We have been, and certainly there's no definitive model in any of the three cases quite yet, but some of the things that we're looking at, because unlike the middle school, it's a little bit more difficult to keep students at the high school level in cohorts because all of their schedules and the courses that they're taking vary from one person to the next, and there's no teaming that takes place at the high school level. So at Westford Academy, we are exploring things like reducing the number of transitions. So we may have less classes each day, still having the students take 7 classes. So it would be on a rotating schedule, but less classes each day for longer periods of time. We are incorporating quite a lengthy transition time, relatively speaking, between classes, so that if we are switching classes, we will sort of dismiss students maybe by class, like if freshmen go first and then 2 minutes later, then the sophomores travel and so on. I do know that in the operations subcommittee, they're looking at just making sure the hallway traffic is marked in places where hallways can be one way. That's preferred, but obviously the layouts of our buildings vary quite a bit and don't necessarily lend themselves to that. So just making sure having sort of 2-way direction, staying to the right like you would on a road, and minimizing the contact points throughout the day that way.
Thank you.
In always, Chris, if I could just say,
Sure.
the distancing issue that we're addressing in the hallways is front to back of students. The hallways are of such a width, based on building code requirements, that there is certainly sufficient distancing that does not necessarily necessitate all students traveling in one particular direction. They can be traveling back and forth, but we have to keep monitoring sufficient distancing between them.
Thank you. There's been a couple of questions about ventilation, and specifically this one is just saying, will air quality testing be done in the schools before returning to school? Other districts have started this testing.
Yes. First of all, keep in mind the buildings have been closed for several months. We periodically do air quality testing. One of the things that we have ordered is some CO2 detectors, so that we know what the CO2 level is, whether it's higher than a kind of a threshold level of 800. We will do that throughout the year. One of the things that we have always done, and I think the staff will, we'll talk about this with the staff tomorrow. We've always taken pride in having some of the cleanest buildings in the entire Merrimack Valley. And I mean that seriously. If you're a resident of this town and you go to schools in some other communities, you'll see what I mean. That our custodians and maintenance staff take great pride in our buildings. We test the air quality periodically. We have ordered either 4 or 5 CO2 detectors, because an elevated level of CO2 certainly means that there is not enough air exchange in a room. Now, I have checked with Facilities Director Paul Fox, and he has indicated that everything is working properly. There is some already scheduled work that has been on the books for a number of months at the Abbott that will be completed by the end of this summer, and one of our other schools also that's going to be completed, so that we check for mold, we check air quality. Whenever any staff member sometimes says, I seem to smell an odor, or the air seems heavy in the building. So we pride ourselves on safe conditions, and we will continue to pride ourselves and provide safe conditions for staff and students.
Thank you. This is also, if Jeff can help us out with this again, some people are asking specifically what symptoms would require a student not to come into school.
All right, so as far as your symptoms go, the symptom list is growing all the time as the CDC learns more and more about this particular disease. It initially started with shortness of breath, fever, headache. It's gone into loss of taste. It's gone into cough, stomachache, nausea. What I would recommend you do for any parent, you're going to see the symptoms of COVID mimic several other diseases that we also have that we've been following and treating for a long time, such as the flu. If your kids are sick, you need to keep them home. There is not a specific symptom that you should be necessarily paying attention to. If your child is off, if faculty is off, if you have a fever, if you have a cough, those are reasons why you should limit your exposure to other people. So as far as any one specific symptom, it's really difficult to say because there are so many and that list continues to grow. But the strongest message we can send is if you are sick, if you know you're not right, stay home, and if need be, get medical attention.
Thank you. There's been a number of questions specifically asking for more information about the hybrid model. So can we take a few more minutes to explain that more specifically?
Kerry, you want to kind of tag team this, or do you want to take this? And I'll be glad to chip in.
Sure. Yes, so we're looking at multiple hybrid models. In some cases where the school cannot hold students even at 3 feet apart, or it's exceptionally difficult, we are looking at a 50% in, maybe over the course of 2 days. So if a set of students, 50% of the students come in Monday, Tuesday, then they're home working remotely on Wednesday and Thursday, and those students who started the week remote would come in. So we're looking at multiple options such as that. When we're looking at hybrid models, it is mainly because of a capacity concern, and at some other levels, while we may be able to have students in the building, whether it be 3 feet or 6 feet apart, we also know that capacity issues are also not just having enough space in classrooms, but it may be having enough space in the lunchroom, coverage for lunch, substitutes, even just students wearing masks for a full day. So in some cases, we have models where the hybrid is students come to school for half the day and then they go home and they have live remote sessions for the other half of the day. So these are the types of things that are being brought up and teased out in the Teaching and Learning Subcommittee. So we don't have them specifically designated yet for what hybrid would look like at each level, but those are just some ideas to help you understand what we're looking at for the hybrid.
And I just want to chime in, Carrie, just to emphasize what I had shared earlier, that even in the hybrid model, if some students are alternating, we will be taking a look at our most complex learners and our youngest learners, those who cannot access from a remote, and make sure that they are coming in to the maximum extent.
When we talk about the hybrid model, there are a couple of issues. It's that first and foremost, if we go to the 6 feet of distancing because we think that's safer, that will require us to adopt a hybrid model. But what Kerry and her team are working on is, regardless of the hybrid model, what represents quality instruction? And that's very important. And I know her team has had some long conversations over that and talking about different alternatives, how it impacts planning time, how it impacts a number of school operation issues. So once again, one of those issues that sounds easy, but is very complicated in terms of sort of the domino effect of other things.
Thank you. So some parents have been asking about when they need to make their choice if they were going to opt for fully remote, or whether it's a hybrid or whether it's a full return. So if we can talk about that timeline.
Well, I'm hoping that people will wait until I make my presentation on July 27th to the school committee. We'll have the entire reopening committee present also, because I think that's when everyone will know what I'm proposing and the school committee could choose something else, but as long as as long as I present a compelling case and the data to support the decision, I think hopefully there will be some support. So I think we still have enough time, but immediately after that, we will survey parents to see what they choose. There are those who will continue to choose only remote, whether we have all students back in or only half at a time, and that's important to know. So, and then that might impact somebody's decision with the hybrid. So, still is a little time left, certainly. I don't want people to panic, but please know, we're working hard to make sure you get the information as quickly as possible, because you have daycare, childcare, all sorts of issues, employment issues, and we understand it, absolutely understand it.
Bill, may I just add one more piece in there?
Sure.
While we are producing all three plans, a full remote plan, a full return plan, and a hybrid model, that will not be a menu option for parents of which of those three they would like their child to sign up for. We will be having and choosing through our work and presentation to Bill, and then his determination and presentation to school committee, we will be determining one of those three options as the primary option, with a full remote alternative for the people if it were any sort of hybrid or in-person option, but people don't want to send their students to school, they don't feel comfortable doing that. They will have a separate remote option for that. But even though we're planning all three, those are not going to be three choices available to parents. The district has to move in the direction of one of those three. And as I said, offering that alternative for the full remote students who choose not to come in.
Correct. One recommendation I'm making to the school committee, as Kerry said.
Carrie, can you also just talk for a minute again about exams and assessments in a remote learning environment, and just maybe provide some examples of what that looks like for people?
Sure. Well, we have actually been trying to shift to more performance-based assessments versus kind of your traditional study guide and sit down and take a large packeted test. We will probably have to modify how we do assessments if it's remote, but I think shifting back to understanding what the point of assessments are. They aren't to populate a grade book. They are to get the teachers information to help them understand how much learning the children are getting from their instruction. So the assessments may look a little bit different. We have to make sure that we're obviously aware in a remote setting of academic integrity, and we've got to sort through some of the obstacles that would come with remote. But I do know that in order for teachers to understand how their students are performing and doing, they need to be able to assess their work and their learning. And so all of that will be taking place. And in a remote session, it may look a little bit different. There could be some sort of live types of tests and quizzes that are happening in real time. There could be some sort of projects that students can work on and collaborate together, and then present to the teachers and kind of convey the process of creating whatever product it may be. So there will be a wide variety depending on what the learning objective is, but assessments and grading will take place.
Thank you. There's been questions about socialization and the opportunities for students with all of the physical distancing. Can you talk about the plans to handle the socialization of children, especially if it's difficult for them not to be close together, if they have to wear a mask for the whole day, even with breaks? I mean, the different types of things that have been discussed in the committees about the strategies that teachers will be using to support students.
Well, I know in our operations subcommittee, we've talked about having students taking breaks from their classroom, moving to a larger common area where they can be appropriately distanced with some directed activities, maybe even some fun activities to break the monotony of wearing a mask for a great period of time and to increase that socialization. You know, as I mentioned at the beginning of the program, it's all about connecting. Whether you're an adult connecting with a child connecting with an adult. We want as much socialization, and that's part of our social emotional adjustment committee work that's being done now is what types of activities do we do during the school day to promote those on a grade appropriate basis and a space appropriate basis. That is still very much a work in progress, because the very last thing we want to do is have a child sitting at a desk for 5 or 6 hours a day, essentially, other than for bathroom breaks and recess at the elementary level, immobile with a mask on, with a few breaks. So those are things that we are incorporating into the plan in terms of suggestions of what we can do at various grade levels.
Thank you. There's a couple of questions about the financial implications of these different plans in terms of being fully remote or coming back fully. Can you talk a little bit about what we know about potential financial implications and then the unknowns that still exist?
You know, Ingrid, I can tag team this one with you if you wish.
Sure. It really depends what model, like we keep saying, what model is chosen. As we know, the greatest cost to our school system is our wonderful staff. And depending on the model that is recommended and where we are at that point, if we need additional staff for spreading the kids out and having the proper supervision, buses is going to be a huge concern. We are still awaiting guidance on how many children can ride a bus, what kind of spacing will be necessary, what will be, we as a district will be able to offer as transportation. Depends on the capacity. I mean, obviously there's a financial aspect regarding transportation, but there's the capacity to, even if we had all the money in the world, we can't conjure up extra buses. So it's a huge puzzle, and we are eagerly awaiting some guidance there, because that's going to factor in on the cost aspect considerably. Also, any sort of hybrid model where within one day they're more than the traditional runs to school and home. Bill, is there anything else?
Well, let me say that in terms of finances, the Department of Ed has indicated that it would be hoping to allocate $225 per pupil to cover some of the costs, incremental costs associated with, for example, additional staffing. I think we might have said bus monitors. We're talking about maybe additional recess monitors, lunch monitors if we have them, if we have lunch in the buildings, monitors for bathroom breaks. If we have lunches in the classrooms, how do we ensure that a teacher has a duty-free lunch and recess? Do we have to hire additional, classroom monitors for that? Now, if we receive that $225, that's about $1,100,000 in the ballpark. But in a meeting with area superintendents today, we were all discussing that there has been absolutely no discussion of that to this point in time in terms of, is it a source? Is it actually from the federal government, transitioning through the state? When might it be available? How do we access that? What's the distribution of that? Is the distribution based on the type of student population that a community has, with families in the urban areas. And, I worked in Lowell for 16 years before I came out here. Or, our communities like Westford penalized to some degree. Now, I know that the federal government and our state legislature is trying to do the right thing. But none of us know right now how to even access that money or when it's accessible from the state. And we have costs that we are incurring to make sure that children and staff are safe, and we can run operations, school operations to some degree, whether it's one of the three models, and we need to be able to have that information. So I'll be speaking with Representative Sierra this week to say, what is it that we need to do in all communities to access that money?
Yeah, the state really hasn't provided any guidance, and I do have to emphasize what they keep emphasizing to us finance people is that it's up to $225 a student. It's not just flat out $225. So that leads me to believe that there will be some criteria depending on what kind of community and based on community need. In the first distribution of the Educational CARES Act funds, Westford only received $20,000.
The next question, again, is organizational in nature and logistics, and asking, are we planning additional traffic for those who choose not to bus?
Now, we're looking at that right now in terms of do we alter any of the school starting and closing times? Do we need traffic monitors out there? As you know, that's why, as I said many years ago, I started the early arrival option, was to sort of pace the arrival of vehicles, whether they were buses, vans, or private parent vehicles. Now, with the lack of the early arrival option, our suspension of that, at least for the beginning of the school year, and probably into the first quarter at least, there will be more traffic. There's no question about it. I've talked with Chief McEnany about it also. Now, he's struggling in terms of the size of and the availability of his police force in terms of trying to monitor it. So I think we're going to have to hire some of our own traffic people to facilitate the movement of particularly of cars. In some instances, we're going to have to reconfigure where buses enter and where private vehicles enter. And we're looking at that right now also. Each principal is sort of working a plan out that we've kind of figured a factor of maybe 20 to 30%, probably more like 30% more vehicles. And how do we handle that in each school?
Thank you. The next question, it might be possible to get some of the school committee members to chime in as well too, because the question is if after the presentation, if the school committee does not agree with your recommendation, what are the next steps in that scenario?
Well, I wouldn't hesitate to answer that. If the school committee disagrees with my recommendation and chooses another model, we immediately go back to the drawing board, although we will have the particulars of those other two models ready at that point in time. So by going back to the drawing board, I mean, make a decision. If the committee makes a decision, if they want to either go full remote or full return, we'll be ready for it. And the committee that's very thoughtful, puts a lot of time and effort into decisions. Gloria, I'll stop and allow you to. Oh, you're muted, Gloria.
Thank you. I think that school committee recognizes that we have a role in this process, but we also have to be mindful of what that role is. We are not professional educators. We're not nurses. We're not epidemiologists. So we have been elected to represent the community and the community's interests, and we will evaluate the plans that come before us, but we also know what the limits of our expertise are. So we are really going to be looking to our professional staff, our administrators, our professional teaching staff, and very critically our nursing staff, and look to them for their guidance as to what makes sense for our community. And what makes sense for our community may not be the same thing that makes sense for other communities. At the start of this whole process in March, there was initially guidance from the state saying that we shouldn't close schools district-wide. And Superintendent Olson came to the school committee and said, I think we need to close the schools, and made that decision with school committee support at that time. School districts around the state started making that same local choice. And ultimately, then it was decided that schools statewide would close. But that decision was really made locally based on the expertise in our school system that was then recommended to us. And it really was a group effort and a grassroots effort. And I think we need to follow the same process here. So we understand the limits of our expertise, and we're looking to our professionals to advise us and bring plans to us. We will, of course, then ask lots and lots of questions, because this committee likes to do that. And we've also really appreciated being able to hear all of the questions from the community tonight. That's been super helpful.
Thank you, Gloria. In that same vein, I certainly apologize to all of the people whose questions did not get addressed specifically, but remember, we are taking all of these questions and we're going to collect them thematically and create a frequently asked questions document from this webinar, so that we will address all of these different questions if they were not covered in some way as we get closer to the end of our time. There is a question about ways in which we can support the parents if we go with a hybrid or remote plan. And so the question is can there be webinars set up to bring the parents up to speed with technology so that we can be helping them depending on what it is that we end up doing?
I think that's an excellent question. I know we don't have Julie Boudreau, Director of Instructional Technology, but Carrie, if you could fill us in on the conversations that you've had with Julie and others.
Absolutely. We worked very hard to quickly create a website for parents, tools and resources. And from our perspective, we understood what pieces were important and organized it in a certain way, and we'll certainly be sure to do that again. But we will have a more explicit series maybe of meetings with parents. I think the person who asked the question asked about webinars, so that we can just show exactly how to get to certain areas within the technology, how to log students on, and communication to parents at all levels, but of course, particularly at the younger levels, will be key to making any remote aspects run smoothly.
Thank you. Courtney, can you join us again to talk about pre-K and the integrated preschool and what we're talking about with those options?
Sure. So at this point, we are planning for our preschool program to run. Clearly, having it up and running with full integration from our peer models from the community. Those are our tuition paying special general education students who join our students who qualify for preschool for special education purposes. However, if we go into a hybrid or a remote, there will certainly be implications to the amount of days that that student has signed up for. And it is our goal to maintain that integration. We value that model. It is very beneficial to the students. But unfortunately, and I had mentioned this during Monday night school committee meeting, there are many families who choose preschool for two different reasons. One, for the developmental needs of their child. The other one who, yes, are looking at the developmental exposure to social interaction for their child, but also rely on that for daycare purposes. And so, unfortunately, our late decision on what preschool is going to look like for the role model students will probably impact those families who are relying on 5 days a week, whether it's full preschool that they have been signed up for and have been accepted into, or if it's 5 mornings or the 4 afternoon option. So we will try to get that communication out to everybody as soon as possible. But clearly, if we're looking at hybrid and we are trying to reduce the number of students that are in each classroom to make sure that we are socially distancing 3-year-olds, which, as you can imagine, will be even more of a challenge, we will be reducing those numbers. And those will be difficult conversations that I will have to have with family members. We will also be reassessing throughout the year. Let's say a vaccine comes into play soon, then perhaps maybe in January we would be able to open it up if we've had to shrink down the population in order to welcome our students back and provide that opportunity to both the students and to the families. In regards to the special education students that are part of the preschool program, yes, preschool will definitely be running. And as I stated earlier, they will be part of our priority that we will be trying to bring them in for their in-person services, even if we are in a hybrid or a remote model. We will still be targeting them as needing to get their services met.
Thank you. There was also just a question about full-day kindergarten, saying that the first payment for full-day kindergarten is due in early August. Will it be deferred until a decision has been reached?
I think that would be my preference at the present time. We need to make sure we know what the program looks like with certainty. And so whether it's, in early August or in early September, I don't think it makes much difference to us as long as we can provide the parents with an understanding of what the program looks like with fidelity.
Thank you. Probably the time for our last question before any final thoughts. There's a question about the return policy to school, specifically when people have been out sick. I don't know if Jeff can also help with any suggestion, guidance. There are things that we've been talking about.
Sure. So the return policy to school is going to, well, what DESE is going to recommend, we don't know yet, but I'm going to imagine that it's going to be based off of what our state epidemiologists are already recommending for returning. If somebody has been sick, there will be a quarantine period. When they reach the end of that quarantine and they're no longer sick, they'll be able to return. That number will change from case to case depending on when somebody was identified, but we're going to wait for the final guidance on when somebody will be able to return. Currently, it could be 10 days after you have been asymptomatic. It might be 14, depending on when you were identified as positive. So right now, we are going to wait for that remaining guidance, and it's going to come most likely directly out of the current practices we're using with anybody who has been quarantined or isolated.
Thank you. We have time for one more here, and Courtney, I'm going to put you on the spot again one more time. This is specifically about occupational speech physical therapists, whether they've been given training and are they okay to provide teletherapy for remote learning?
So when our school closure initially started, the speech pathologists were not provisioned to provide the teletherapy. Their organization, as directed under ASHA, had very specific guidelines that they must complete specific training in order to be teletherapists. So that certainly delayed a lot of our services. Quickly, ASHA started receiving some pressure to make sure that we were able to provide teletherapy, and a lot of their rules and regulations kind of loosened up. They have made their learning pass, which they call their professional development, available and free to speech pathologists. Initially, it was going through the end of June, and then they extended it into the fall, realizing we're still in this. So our speech pathologists have been actively working towards their 10 hours of professional development that would be needed to do teletherapy, and they will be ready to roll for sure. Actually, we're doing it right now in our summer program. So one of our speech pathologists is doing a great job. She has gone through the training, and she is providing all of that teletherapy for speech and language. OT and PT are definitely a little bit more challenging. Yes, they can provide teletherapy. Our goal for both of those therapies will be in person if we are allowed to do so, meaning we have the proper PPEs, the families are comfortable with it, and nobody such as the commissioner or the governor has shut us down. Some of the challenges around OT PT is that, like I had said before, there's a lot of hand over hand. There's a lot of manipulation going on. And in order to provide true teletherapy, we would have to equip each one of our therapists with overhead cameras, wireless mics, a lot of different types of provisions that would be challenging to do, depending on where those therapists are and where at that time that they're providing the therapy. So yes, we are committed to providing therapy in a more robust way than we were able to do so in the spring. And we are hoping that the families that we are servicing in the summer are feeling a little bit more of the robust services that are being provided remotely, and that we will be ready to roll.
Thank you. Bill, throw it to you for final thoughts as we're in our last minute here.
Well, I want to thank everyone for taking the time to attend this forum tonight. A special thank you to Sana and Michael, our ASL interpreters, for doing an outstanding job, to our school committee, to our central office administrators, and for Jeff Stevens for devoting another 2 hours with us. I think Jeff has spent more time, and Gail Johnson, with us than most other people in terms of advising us. We know that you're anxious. We're all anxious because we wish we could give you the answers with certainty right now. There is some more information that we need from the Department of Education in terms of guidance, whether it's academic, social, emotional, logistical, students with disabilities, or dealing with transportation. As soon as we receive additional guidance, our team is working to see how that fits in together. Our team being the reopening committee, the 40 plus people that we have. So know that we're working hard. Don't be misled that we might be behind other school systems because one or two have published their plans. This is not a race to the finish line to see who publishes their plan first. This is a plan that needs to be thoughtful. It needs to incorporate all sorts of information. It needs to be right for the town of Westford and the Westford Public Schools. Many of you have been with me for a long time, with multiple children. And you know that we have tried to make the right decisions for your students in the school system. And that is the guiding doctrine that we are following through this whole process. So I want to thank you again. You've been very patient. Please, if you have any other questions, you can send me an email. I'll have a particular file that we will develop them and work them into a frequently asked question document, because I do want to make sure that you feel comfortable, that you know that we're hearing you and we're listening to you. Even more important than hearing, we're listening to you. Okay? And we want to respond to you with the answers that would make you feel more comfortable and can make an informed decision about sending your child to school or not sending your child to school. We'll have another forum tomorrow with our teaching staff, our entire staff, our school system. I'm looking forward to that. Always appreciate your suggestions, your comments, and your constructive opinions. Thank you very much and have a great night.